the team members here of this team.
Hello.
Stuti, Sarthak, yeah.
Yeah. So good evening, everyone. I'm Stuti Bajpai, and along with my teammates Sarthak and Sharanya, we will be speaking on healthcare with a specific mention of COVID-19 in all our topics. So I'll be writing on vaccination policy with a specific mention of COVID-19 vaccination and the role of government. Next slide, please. Next slide, please.
One second. I'm sorry.
Okay, so I'll be speaking on major policy debates, priority list, age group to be vaccinated, which means that vulnerable group above 45 years should be vaccinated early, then provide vaccination to the relevant poor economic countries so that if they will get affected, they could not afford money for the treatment, so they should vaccinate it first. Then vaccine to provide in areas of higher population density, which means that Maharashtra have higher population density. So if those state will vaccinate it first, then the cases and infections rate gets lower. Now, Sharanya will be speaking on the major stakeholders.
One second. I think there's some trouble
No
changing
issue,
the slide.
no
Just give me
issues.
one
You
second.
carry on speaking. No issues.
Yeah, so the major stakeholders that we've included is the government, the citizens, and the health ministry and the judiciary. Stuti, do
Okay.
you want to go ahead and talk about
Yeah.
your topic? Yeah.
Okay, so I'll be talking on role of government during this COVID pandemic and majorly the vaccination thing. Vaccinations are one of the most successful health interventions that bring about significant uh, reductions in the infectious diseases and adverse health consequences and improve quality of life in the population. So now I'll be talking about role of government in promoting this policy. Trust in vaccination and the ability of government to communicate and to successfully deliver a vaccination program is critically dependent on these five aspects. The extent to which the government can instill and maintain public confidence in the effectiveness and safety of the vaccine, the competence and reliability of the institution that deliver them, and the principle and process that guide government decisions and actions in vaccine procurement, distribution, prioritization, and administration. The capacity of effectiveness of regulating agencies in handling issues and communicating consistently as events arise while retaining public confidence in their review process, the effectiveness of the public engagement and communications that accompany these. So, the direction of India's vaccination strategies was set up in PM Narendra Modi's initial meeting, set up in subject in May 2020. The PM told top officials to look at private companies making vaccines as partners. So, India's entrepreneurial state has worked in a never before seen manner to ensure the obstacle to quick vaccine delivery. This has happened due to PM Modi's focus on making the government work as an incubator for vaccine development. And now the results are visible today that when India is able to vaccinate more people daily than any other country in the world. So there are three research questions from my side. First is, does government prioritizing promoting vaccination to vulnerable group of population? Second is, does government providing free vaccination to economically backward population? And last one is, people are suffering from vaccination hesitancy. Government is able to promote positivity among people to take vaccines or not. And my motivation of this topic is as COVID-19 pandemic isn't going anywhere anytime soon. So, and it affects major aspects of human life. So, I just want to learn and research more on this topic. Thank you. Over to you, Sarthak.
Yes, thank you. So I am Sarthak Khanal. I am currently pursuing my BLLB degree from Nepal campus, Tribhuvan University. So I'll be emphasizing upon the role of judiciary in healthcare management and the priority that is accorded to the judicial sector. So judiciary has indefinitely played a prominent role in the recognition and promotion of fundamental rights that includes the right to health and also the various other fundamental rights that have been guaranteed by the Constitution. So in the context of Nepal also, the picture depicts the same. And if you refer to the case of Lakshmi Dikta, that assured the right of abortion of the woman, and also the case of Prakash Mani Sharma that assured the right to food of the people. So the judiciary has undoubtedly played a prominent role in the recognition and protection of the fundamental rights. So the efficient functioning of the judiciary is quintessential for the sound administration of the government. And also during the period of pandemic, the judiciary has been constantly and incessantly working for the protection of the rights of the citizen and also the maintenance of rule of law in the country. So the state needs to adopt a policy to prioritize and accord protection to the individuals or professionals that are engaged in the legal field who play a prominent role in the society. So my major research questions during my research will be the role of the judiciary in the enhancement of the health-related rights through the litigation, the policy that has been adopted by the state to accord protection and priority to the professionals that have been engaged in the judicial field, and also the need of the time to bring changes, the policy that are required to be brought for the efficient functioning of the judicial department and also to make it technology friendly. Thank you.
Thank you, Sarthak. Hi, everyone. This is Saranya speaking. I graduated with a bachelor's in business administration and business analytics, and my topic under healthcare would be mental health in India during the pandemic. And I wanted to focus on two aspects, which is the accessibility of mental health resources and action. So one is understanding the pandemic's effect on mental health of the citizens. Second is the implementation of national mental health policy. How efficient was it, and how and what is its efficacy? And the third point that I want to understand is bringing an intersection of gender and caste. Again, focusing on the accessibility. My research questions would be, does the larger Indian population understand what mental health is? Because even in our daily conversations with our parents or with grown-ups, when we talk about mental health, they push it away with um, something casually that it'll pass or something like that. But I wanted to understand, as the larger population knows the importance of mental health is. And the second is, how accessible was mental health resources during the pandemic? And a sub question under this is, if it was accessible, what was the efficiency rate of those resources that people obtained? And the third sub question would be, what was the toll on gender and caste specifically? Now, the motivation for me to choose this topic is, few weeks ago, I conducted a survey with 30 people, and over 50% of the respondents said that their mental health was largely affected during the pandemic. And I wanted to explore a bit more on this. So that's that, and thank you.
Thank you, team. Now I call informal economy in India.